In tonight's Healthier Me, an exclusive look at those who help heart attack patients. Chest pain, unexplained weakness, or shortness of breath. Any of those signs could lead to trouble.
Valley News Team's Macy Anger got a glimpse of what happens when the all-important help arrives, and she joins us now. Macy?
Mike and Stephanie, heart attacks are more common than you would think, and every minute matters. So we wanted to take you where cameras hardly go. Inside the ambulance, through the hospital halls, and surgery. Just like a heart attack patient, I found out firsthand what you should do if you're ever in the same situation.
102. The address of the emergency.
Respond emergent to the KVL Live Studios.
It can be somebody shoveling snow, it can be somebody sitting down watching TV. That can happen at any time.
FM ambulance paramedics help at least 8 people each day who are having a heart attack.
Going to hook up a thing to your finger to check the oxygen in your blood, and then we're going to put some patches on your chest to take a peek at your heart.
Before you even get in the ambulance, paramedics can detect if you're having a heart attack. They'll ask you questions like, have you taken aspirin? If it's needed, give you nitroglycerin.
And one more.
And oxygen.
Good. So this is your heart tracing here, and there's some signs in here that would tell me that you're probably having a heart attack.
These paramedics are some of the best. The national average for getting a patient to the operating table, 90 minutes. Locally, that average is closer to 60. But paramedics say not everyone will call for an ambulance. Is that a common thing you find, people trying to drive themselves into the hospital?
Yes. A lot of people drive themselves into the hospital, and you can still get very quick and timely care. The difference is that if you go into an emergency room, that heart test that I did on you that says you're having a heart attack, if you go into the emergency room, you have to do that there. Then you have to activate the cath lab.
No matter the time of day, Sanford doctors say it's better to call 911. Now, is this a typical entrance where people would be taken in at?
This is where we would take you in if you were having a heart attack. This is the actual place.
At the hospital, we winded through hallways up the elevator to the cath lab, where surgery would take place.
Nowadays, it's essentially in the high 90% range surviving. Back in like the 60s, 70s, it was 60%. So it was a much more common to be a fatal event back then than it is now. And that's because we have these protocols, we have these therapies.
Doctors say the most important thing, don't avoid chest pain.
Time is muscle.
Because your recovery could go from a few days to a few months. Now, as I mentioned, doctors say depending on your heart attack, recovery is relatively quick, unless you have heart muscle damage, and that can take up to 6 to 8 weeks to recover. Now, in an extreme case, you may have some heart dysfunction, fatigue, and shortness of breath. Doctors do say to prevent a heart attack, focus on any risk factors you can control, like high cholesterol, diabetes, and stop smoking. Mike?
Thanks, Macy. Let's hope that's the one and only ambulance ride you take. The American Heart Association is hosting a walk this weekend to raise awareness about the risk factors of cardiovascular diseases. We've included information about prevention and the walk on our website. Just head to valleynewslive.com and click on this story.